To assist a patient with dining, the very first thing you have to do is check the plan of care to see if there's any special instructions or special equipment needed. If there are, then you make sure you want to gather your supplies. Then I'm going to go down to my patient's room and do my beginning 5. After I'm in my patient's room, I'm going to assist my patient to use the restroom, to make sure she has all of her grooming done, fixing her hair. You don't want them to have that flat bed head look in the back of their head. I'm going to help her with her oral cares and to wash her hands. And then we're going to take her down to the dining room. Here we go, Liz. Go ahead and have a seat. And then I'm going to bring her her tray. I'm going to place a napkin on my patient to protect her clothing. I'm going to make sure that I check that I have the right patient with checking the tray card to make sure that I have the right patient and the right diet. And I'm going to wash my hands again before I help her with her any eating. Actually, I'm going to sit down at eye level across from my patient. How are you doing today, Liz?
Fine, thanks.
Good.
I'm hungry.
Good. And I'm going to make sure that I offer fluids first. And then I'm going to fill only the first half of the spoon. Here's some Jell-O, Liz. I want to make sure that I give my patient plenty of time to chew, and I want to offer fluids in between bites. Would you like some more water? Mealtime is a great time for conversation with your patients, but not when they're chewing. And I also want to encourage her. Liz, do you think that you could maybe hold on to the cup yourself?
Yes, I can.
So you want to encourage them to do as much as they can for themselves, but if they're not able to, make sure that you're helping them to eat. Are you finished eating, or would you like any more food?
No, I'm good. I'm full, thank you.
Okay. So you want to make sure that you're encouraging them to eat, but you never want to force them to eat. When they're done, you'll help them wipe their face and hands. And then take their tray. I'll take this from you. And before I put this back in the tray cart, I want to make sure that I take note of how much Liz actually ate and how much she drank, and I want to write that information down. So I'm going to take this away. And then I'm going to assist Liz back to her room if it's appropriate. I'm going to come on back to your room. After we return to her room, I'm going to make sure to offer oral care again and perform my ending 5.